Good afternoon. I tell you, this is it's always good when you have a crowd that you don't have to say, let's try that again. Well, folks, no big secret why we're here. You can read it in plain English right here. We want government to get their hands off our health care. We don't need a doctor to come between, or we don't need a politician to come between us and our doctor. Besides, when was the last time you saw the government do something better than the private sector?
Never.
Not the post office.
No.
It's not the DMV.
No.
I can't find an example. It's because there isn't one.
You're right.
Social Security. We've started this bus tour here in Virginia. We're going to 26 localities throughout the Commonwealth. We started 3 days ago in Richmond. Went down to Amelia Courthouse in South Boston, Danville, Martinsville. Went southwest. We were in Southwest yesterday. Bristol, Gate City, Norton. We were in Bluefield this morning. And I'll tell you what. How many of y'all been to Bluefield? Yeah. Would you believe more than 50 folks showed up in Bluefield? We had 400 in South Boston. We have hundreds here. This is incredible. Folks, this is a testament to how strongly we feel about this. People have been saying for so long, who is the silent majority? Well, I'm glad to see the faces on them now. What's this ruckus about universal health care? Why are we upset? Folks want to know. Liberal do-gooders say, what's the matter with everybody having health care? Well, there's nothing wrong with everybody having health care. We want people to work hard and provide it for themselves. And of course, for those who can't, or physically or mentally unable to, we're not going after that. That's not what this is about. You hear about the 45 million folks that don't have health insurance.
Yeah.
What you don't hear about is the third of them that opt out on their own.
Right.
What you don't hear about are the illegal immigrants who will have it under this plan. Once again, we want everybody to have health care, but we want them to work for it. So what is this? Let's go down the dark street of what happens if this passes. What happens if this passes? God forbid. You better believe it. We know that health care is a product, just like the shoes on your feet or the car you drove in here in. And like any product, it has limited resources. So if you mandate that you give it to everybody, what's going to happen to that care? It's not going to be enough to go around. That's just a fact. So what do you do when there's not enough of something to go around? You ration it. That's right. And you know who's going to have it rationed on them? Not me. Not yet. Seniors. But this generation, my generation, this young man right here, his children's generation are going to pay for it. We can't let that happen. Not in America, not in Virginia, not here in Roanoke. Now, they've got this other thing in the bill called life counseling. Y'all heard about this? Scary. Scary. Death counseling. They are going to require that when you reach the age of 65, that you go sit down with some bureaucrat and talk about all sorts of options. Folks, when I get to be that age and I have to make decisions that folks are forced to make, I want to have that discussion with my minister and my family, not some bureaucrat. So what are we going to do about it, folks? What are we going to do about it? Rick Boucher sold out on coal. Is he going to sell out on health care? Is he going to come between you and your doctor? We got to tell him no. We got to tell him no. We got to make sure he votes with this district in the 9th. Bob Goodlatte's going to vote the right way. We know that. What we don't know is how Rick Boucher's going to vote. And we don't know how Jim Webb and Mark Warner are going to vote. And we know they're scared. You know how we know they're scared? Because they had to have Air Force One come down to Bristol yesterday.
Yeah.
By the way, any of you guys know where we were yesterday? We took the Hands Off My Healthcare Express down to Bristol to say howdy to the president. He didn't seem to want to say howdy to us. But we're taking this bus all across the country. We're not just in Virginia. When we get done here, we're going to North Carolina. We're going to Pennsylvania. We're going to Indiana. We're going to Montana. We're going to Wyoming. We're going to take this bus all across the country and send a message that those Washington politicians need to take their plan back to Washington with them. Only problem is they don't want their plan either. Because what have they done? Who's exempted? You got it. We want to know whether Congressman Boucher and President Obama are willing to have the same health coverage they're going to force on us. Isn't that fair? We also want to make sure if they're going to vote for this bill that they had better read every 1,018 pages of it. You don't have to read the whole bill to know it smells, though. And we know that. There are examples throughout this bill of why it's not good. And that brings us to what are we going to do about it? How many folks here have called their congressman or senator? That's great. That's excellent. That's excellent. How many folks have written a letter? That's even better. Now I'm going to tell you the one thing, though, that makes a bigger difference than anything out there. If there's one thing a politician fears, it's bad press. Write a letter to the editor. If you don't get it published, send it again. You know, papers are funny things. They have a tendency to, ignore some issues and pay attention to others. But you keep writing, and we will get that word out. We will. But right now, I want to do something. When y'all go to church, what do they tell you to do with your cell phone? Turn them off. All right. Well, we're going to turn them on. I want you to pull out your cell phone right now, right here, and we're going to call Rick Boucher. Okay? We're going to do it. We're going to call, and if the first few phone lines fill up, I'll give the number out for Mark Warner, and when that fills up, I'll give out the number for Jim Webb. And we're going to take a couple minutes here and call these offices. Now, if you get a voicemail, leave a message, okay? Leave a message. If you get a staffer, tell them you're from Roanoke, tell them where you're from, tell them you're a citizen of Virginia and you expect them to do the right thing and vote no on Obamacare. Okay? All right. Oh, yes, and Tom Perriello, I'll write. How many 5th District folks we got here? That's great. Okay. All right, well, if you're in the 5th District, Tom Perriello's number is 202, and after I say it, I'm going to try to quiet down a little bit. 202-225-4711. That's Tom Perriello.